In order to evaluate hip dysplasia, where the measurement of hip dysplasia index is acetabular index, the center edge the acetabular depth-width ratio, Reimer index, the congruity index, the Sharp's angle, tonus grade of dislocation, the acetabular index of the weight-bearing zone, and congruence index by using the patient's X-rays over the X-ray viewer. The classic standard way is the manual measurement with protractors, rulers, well-sharp pencils, transparent paper, to draw and calculate and weigh all these indexes, in order to have a diagnosis of what is pathologic and what is normal of the measured values. Every value have been compared by age, gender and site-specific reference from textbook databases by the user in effort to evaluate the result the most objectively way. The app calculates the 9 above-mentioned indexes in 34 seconds compared to 30 minutes for manual measurements. The Hip Biomechanics app computes weight-bearing contact surface, the load, R, and stress, P, on the measured hip, data from load and pressure distribution in the hip, like in a real biomechanicals tests, are being measured and depicted graphically as vectors over the X-ray and the screen over the joint. The distribution also of compressive stresses over the acetabulum, which is usually associated radiographic sclerosis over the acetabular margin, are printed in real time over the screen and thus can be easily and objectively evaluated. Besides that, the app provides for all indexes and measure data an export module for diagrams of load, R, pressure, P, which each can be plotted as a curve, allowing easy comparison with normal data and thus help decide the orthopedic surgeon which procedure is objectively indicated. Residual dysplasia is presented and can easily be detected by the app. Notice how quick and easy all necessary data are calculated during preoperative templating. Real values are estimated, thus identifying the optimum pressure distribution and load, and help decide which kind of surgical intervention, varus or values and or pelvic osteotomy, are appropriate for each individual according to unique patrient features. Occult dysplasia not easily previously seen by naked eye are exposed and treated accordingly. An established method of treatment of developmental dysplasia of the hip, DDH, is the use of abduction splint also in walking children. To achieve a favorable outcome in treatment of DDH, the abduction splint has to place the leg in such abduction, thus allowing concentric distribution of pressure of the femoral head inside the dysplastic acetabulum and inducing the remodeling of acetabulum towards normal. The surgeon is usually faced with the dilemma how much abduction is necessary to induce the acetabulum modeling. The degree of abduction of the splint is usually chosen according to surgeon's experience by surmising which is the optimal biomechanical position of the leg in static X-rays. The current abduction or adduction of the hip is measured, and by scrolling a button you can virtually change the position of the legs. By placing more or less abduction, the app concurrently calculates load, pressure and its distribution in the new position, which is printed in real time over the X-ray. Each time you change the degree in real time, the distribution of pressure is printed for the corresponding degree of abduction. Within this procedure, all data are recalculated live in front of your screen, thus allowing to find easily the biomechanically sound position, concentric distribution of pressure inside the acetabulum. This procedure helps decide in an instant the optimal position of abduction of the extremity by changing the abduction of the brace to the suggested advantageous degree of abduction, without repeating X-rays. This will promote uniformly remodeling of the dysplastic acetabulum towards normal, saving time for successful outcome. In addition, the color of the pressure vectors adds very important information about the exerted pressure in the acetabulum. Red means not favorable pressure, green means favorable pressure, thus stimulating the growth. Green with black color inside means very potent stimulus to growth. The changing colors of depicted pressure vectors and the changing magnitude of pressure vectors, which are depicted respectively by the changing length of vectors, arranged over the acetabulum, helps and informs the surgeon both qualitative and quantitative in an instant. If the distributed forces are promoting the growth of acetabulum, green vectors, and helps decide the optimal position of the leg in abduction by the splint.